Coming to the last topic of the lesson, that is disorders of respiratory system. And the first disease which we are going to deal is asthma. Okay, I'm telling you the most important thing. You need to just remember the lines of NCRT for the disorders. It is the only and best method for this. If you better understand, also no use. The most important thing is you need to mug up the lines of NCRT for the disorders. For example, let us talk about the first disease, that is asthma. Everyone know it is a difficult in breathing, it causes wheezing, everyone know. But the main important thing is it is caused due to inflammation of bronchi and bronchioles. Asthma is caused due because of inflammation of option A alveoli, option B bronchi, option C bronchioles, option D is both B and C. Answer is both B and C. So D is the correct option. Okay, they can ask most importantly, and they can reverse also. Which of the following is a false statement? And in which they can give it that asthma is due to inflammation of alveoli. You can understand now how can they frame the questions from the twisting the NCRT lines. Okay. Next, emphysema. Emphysema, you know that it's a chronic disorder in which alveolar walls are damaged and due to which the respiratory surface is decreased. And one of the major causes of emphysema is cigarette smoking. It is a very, very important line. Okay. The major cause of emphysema is cigarette smoking. Okay. So from here they can ask two lines of answer questions. One is what are the causes of emphysema? Like alveolar walls are damaged. Okay. And respiratory surface is decreased. Okay. And respiratory surface is decreased. This is the first important question. And another important question is the major cause of emphysema is cigarette smoking. Only these two are things. Okay. Causes of emphysema and major cause. Okay. And next thing, occupational respiratory disorders. In the name itself, they are given occupation. Occupation means the job you do. The people who go to the work for industries and factories, they may suffer from these diseases. They're given clearly in the lines of NCERT. Those who go to the work which involves grinding or stone breaking, so that the dust can be goes into their body. Okay, so that the dust can go inside their body. Okay, and these long exposures can lead to inflammation leading to fibrosis. The long explosion leads to fibrosis. Okay, fibrosis means proliferation in fibrous tissues, and this can cause serious lung damage. Okay, that's why when we can see that the workers in the factories, industries, everywhere, they would wear some protective masks so that their body doesn't get affected. Okay, this is what for these three disorders. Just mark up the NCRT lines. And the most first two, asthma and emphysema, are very, very important. Occupation is important, but not that much important. These two are very, very important. Okay, that's it. In earthworms, the respiration occurs by first option is moist skin, second option is moist cuticle, third option is lungs, and fourth option is gills. Stop the video and try to answer the question. Please remember, moist skin is for frog and moist cuticle is for earthworm, lungs is for terrestrial forms of amphibians, reptiles and mammals, gills is for branchial respiration like hemichordates, echinodermates for all of them. Okay, so the answer is moist cuticle. Coming to the second question, that is thoracic chamber is lined ventrally by first option is sternum, second option is vertebral column, third option is ribs, and fourth option is diaphragm. Please stop the video and try to answer the question. Please note, thoracic chamber is lined ventrally by sternum and vertebral column lines dorsally, and ribs are lined by laterally, and diaphragm lines posteriorly. Okay, let's say that's posterior and the posterior axis. So we can say down of it or posterior. Coming to the third question, which of the following is correct? First option is vital capacity is equal to inspiratory capacity plus expiratory reserved volume. Second option, vital capacity is equal to inspiratory capacity plus expiratory capacity. Third option, vital capacity is equal to total lung capacity minus functional residual capacity. Fourth option, all the above. Pause the video and try to answer the question. And the answer is first option, vital capacity is equal to inspiratory capacity plus expiratory residual volume, which is also equal to inspiratory reserved volume plus tidal volume plus expiratory reserved volume, which is also equal to total lung capacity minus residual volume. Second option is wrong and third option is also wrong. If you want explanation, please revise the video which I kept. please see the video once. Okay. Which of the following is a passive process? First option is normal inhalation. Second option is forced exhalation. Third option is normal exhalation. Fourth option is all the above. Pause the video and try to answer it. And the answer for this question is normal exhalation. Okay, if you have a doubt, please go and revise the video back. Normal inhalation is active process and forced exhalation is also active process. But normal exhalation is a passive process because everything come to their original position. That's why. Which of the following is also called as sound box? First option is pharynx, second option is larynx, third option is trachea, fourth option is glottis. And pause the video and then try to answer the question. Yes, the answer is larynx. It is the line of NCRT. Please check the NCRT once for if you want any explanation. Coming to the next question, which dash affects binding of CO2 with hemoglobin to form carbaminohemoglobin? It is a line of NCRT. Okay, coming to the first option, that is partial pressure of CO2. Second is partial pressure of O2. Third option is both. Fourth option is none. Pause the video and try to check the answer. And the answer is second option. If you check the NCRT line, that is partial pressure of O2 is a major factor that could affect the binding of CO2 with hemoglobin. Okay, if you want it, please refer page number 274, and then the topic name is 17.4.2, which is transport of carbon dioxide. If you refer that page, you can understand this line. Okay. So this one I missed this point. That's why I'm giving it in the form of question. Remember, O2 affects the binding of CO2 with hemoglobin. Okay, it's an important line of NCRT. Which of the following statement is true about RBC in humans? First option, they carry about 20 to 25% of CO2. Second option, they carry 100% of O2. Third option, they carry about 7% of CO2. Fourth option, they carry about 3% of O2. If you remember in the video which I told that 17.4 transport of gases, the first heading, introduction. I told that you need to remember that. You need to remember that, and I will not help in that. Okay, from that only I framed these questions so that you will not neglect the topic. It's very important. Questions can be asked from that. Okay, pause the video and try to answer the question. Here the answer is first option. If you want, refer page number 274, introduction of transport of gases. Coming to the next question. Every 100 ml of oxygenated blood can deliver. See, it's a very important question. So numbers confused by seeing the options. First option is around 5 ml of O2 to alveoli. Second option is around 4 ml of O2 to alveoli. Third option is around 5 ml of O2 to tissues. Fourth option is around 4 ml of O2 to tissues. And please pause the video and check the answer. And the answer is third option, around 5 ml of O2 to tissues. Very, very important thing. See, here you have a clue, that is oxygenated blood. You know that in oxygenated blood PO2 is very high, and if you refer the videos which I told, there you can understand that oxygenated blood can deliver O2 to tissues. Okay, and then you need to remember it 5 ml or 4 ml based on the line of NCRT. Okay, it's very simple. If you don't know this question, please go and revise the video exchange of gases topic so that you can understand everything, each and everything clearly. Okay. 5 ml how you can ask how 5 ml came. It's line of NCRT. If you see, it is in page number. It is in page number 274, topic 17.4.1, transport of oxygen. Okay, and if you want for 100 ml of deoxygenated blood, which can deliver 4 ml of CO2 to alveoli. This is in page number 275. These both lines are important. If you not understood how these lines came, you need to refer the video of topic exchange of gases. Chemosensitive area, which is situated adjacent to respiratory rhythm center, is highly sensitive to. First option is partial pressure of CO2. Second option is H plus concentration. Third option is partial pressure of O2. And last option is both 1 and 2. Pause the video and try to answer the question. The answer is fourth option. You must why not third option? If you refer the topic the regulation of respiration in NCRT, they clearly mention that last line is that role of oxygen in regulation of respiratory rhythm is quite insignificant. So we can eliminate the third option. So both one and two are correct options. Which of the following disease is majorly caused due to cigarette smoking? First option is asthma, second option is emphysema, third option is cold, fourth option is occupational respiratory disorders. Pause the video and try to answer the question. Answer is emphysema. It is also a line of NCRT.